Hi, welcome to this PowerPoint on taking a blood pressure reading. This narrated PowerPoint is for care assistants and nursing students to learn how to take a blood pressure reading. My name is Pat Clay. I have a Master's of Science in Nursing. I'm a registered nurse. I have a certified pediatric nurse. I'm a certified wound ostomy nurse. Taking a blood pressure reading. The goals of this PowerPoint are to understand what the blood pressure reading measures and to learn how to measure blood pressure using a blood pressure cuff. After this lesson, you should be able to describe how the circulatory system is like a pump, a hose, and a sprinkler, and to obtain a blood pressure reading on somebody. Here's a vocabulary list. If you want to take a picture of this or print it out and make notes by it as we go through the presentation, that might be helpful later. First of all, we're going to look at the circulatory system anatomy. How is the circulatory system like a pump, a water hose, and a sprinkler? Well, the pump is the heart. Pump the pump and feel the exertion it takes and which muscle you're using to pump water through that pump. Let's hook the water hose to the pump. It becomes a little more difficult and requires more exertion. Let's hook up the sprinkler to the end of the hose. Does that take more exertion? How is your heart muscle doing? Is it getting stronger? If the pump is the heart, then the water hose is the large vessels of the circulatory system, and the sprinkler is the tiniest vessels of the system, the capillaries. The red vessels in our picture here represent the oxygenated blood being pumped by the heart throughout the circulatory system through the large vessels, the hose, to the capillaries, the sprinkler. The blue vessels represent the unoxygenated blood being gathered from the capillary fields back to the heart to be pumped to the lungs for fresh oxygen. Then the cycle repeats. Let's take a closer look at the capillaries to see the circulatory system at work. When you press on your finger, you push blood out of the capillaries, causing the finger to pale. But the pink comes back quickly when you release that pressure. The capillaries refill quickly with blood. What you've just done is a very important test that a clinician can use to determine if the circulatory system is perfusing that finger effectively. That's called a capillary refill test. The refill should take under 3 seconds. If it takes longer than that, it might mean that the circulation is sluggish or impaired because your finger is cold, or there is a problem with the pump not being strong enough, or there's a reduction of blood circulating in the system. Now let's go back to pumping the pump. What would happen if I kink that hose a little bit? Well, it becomes harder to pump the pump and it requires more exertion. The muscle will enlarge. There will be hypertrophy of the muscle, or enlargement of the heart muscle. The pressure in the hose will become greater. What if the pump is broken or the muscle is too weak? The pressure in the hose will be low and the sprinkler may not work effectively. Capillary refill allows us to see the perfusion of the tissues in our body. Now let's look at a way to feel the circulation through the pulse. Okay, now let's feel the circulation. What is a pulse? You're going to locate the radial pulse on your wrist. Take 2 fingers at the base of your thumb and slide them down onto your wrist and press gently until you feel your radial pulse. When you feel that pulse, you're feeling the heart contracting. You're feeling the heartbeat. When you don't feel the pulse, that's when the heart is at rest. So let's relate that heartbeat that you're feeling to an EKG pattern. How is the EKG pattern a representation of the heartbeat? Well, an EKG pattern is a linear representation of the action of the heart. The pulse that you feel is the contraction of the heart. It's the peak of the pressure in the vessel called the systolic phase of the heartbeat. When you don't feel the pulse, you're feeling the second phase, which is the diastolic phase, where the pressure is lowest in that vessel. Now, let's look at the instrument that's used to measure the pressure in that blood vessel. The blood pressure cuff is called the sphygmomanometer. The parts of the cuff are the cuff, which inside the cuff there is an air bladder. Here's a gauge that's hooked to the bladder of the cuff to measure the pressure. There's the bulb to pump up the air bladder in the cuff. There's a pressure valve that allows you to inflate the cuff and to release the air from the cuff. Then you'll need a stethoscope with a diaphragm to hear the heartbeat. The size of the blood pressure cuff is critical for an accurate blood pressure reading. Look at your upper arm. Imagine the halfway point. The width of the blood pressure cuff must cover at least 40% of that arm. Here in the picture, it's a little bit above 50%. The length of the cuff, the bladder in the cuff, which is the part that compresses the arm, must cover at least 80% of the circumference of the arm. So when you wrap that cuff around the arm, that bladder has to cover the arm circumference by about 80%. Okay, let's go back to our EKG pattern. How does the EKG pattern relate to the blood pressure reading? Well, remember the systolic and diastolic phases? The systolic is the highest pressure in the vessel where you feel the heartbeat. The diastolic is when the heart is at rest, when it's at the lowest pressure in the vessel. That is expressed in a ratio. Here our example is 120 high pressure over a low pressure of 80. So we say 120 over 80 millimeters of mercury. Hg is the symbol on the periodic table for the element of mercury. Okay, now let's locate the brachial artery. That's the vessel we're going to be measuring the pressure in. So just as you found your radial pulse, put your fingers on your radial pulse and slide them up to your antecubital area, or the inner part of your elbow. Press firmly enough so that you can feel a pulse. That's the pulse we're going to use to take the blood pressure reading. Now that you've located the brachial pulse, we're going to apply the blood pressure cuff and take the blood pressure reading of that vessel. Make sure that your patient has been seated for about 5 minutes and that they've had no caffeine or haven't smoked 30 minutes prior to the blood pressure reading, and ask them not to talk during the reading. All of those things can falsely elevate the blood pressure reading. Okay, place the blood pressure cuff snugly on the arm with the arrow over the pulse point. Don't make the cuff too tight or too loose. You should be able to tuck a couple of fingers in at the top of the cuff. Tuck the diaphragm of the stethoscope under the edge of the cuff over the pulse point, and then place the stethoscope in your ears. Close the pressure release valve and, using the bulb, pump up the cuff to about 20 or 30 millimeters of mercury over what the patient's usual systolic reading is. Here we're going to say it's 120 usually. We're going to pump the cuff up till the gauge dial reads 140 to 150. Now you're going to look at the gauge and begin to turn that valve to slowly deflate the bladder in the cuff. The very point where you hear the first heartbeat is going to be your systolic reading. Here it's 120. Continue to slowly release the pressure and note the reading on the gauge when you hear the last heartbeat. Here it's 80. This is a smooth process. Don't stop and start again, but slowly release the pressure continually as you get those readings. Continue to release all the pressure from the cuff and then remove the cuff from the arm. Okay, now that you have the blood pressure, you need to document the results. The patient might have their own personal log, or you'll have to document in the EMR, or the electronic medical record. The systolic and diastolic are documented separately. In this case, 120 is the systolic reading, 80 was the diastolic reading. You're going to note where the blood pressure was taken. In this case, it was the left arm. You might also be asked to note whether the patient was sitting, standing, or lying. In this case, our patient was seated. Thanks for watching this narrated PowerPoint. I hope it was helpful. You can find more narrated PowerPoints on my YouTube channel at Prof. Clay A+ Clinicals. Also, email me with any questions or comments. My email is profclay2020@gmail.com.